St. Elizabeth Regional Medical Center and Nebraska Orthopaedic and Sports Medicine have collaborated to create this Nebraska Sports Concussion Network. We started this 2 years ago, and we implemented it in all of our outreach schools. And with that is education for the coaches and the athletes and parents, so we've done a lot of that. There's a variety of services that we provide besides the weekly visits and the athletic injury evaluations that we conduct, the athletic event coverage. Something else we help with is we provide them with a concussion testing program, and where these athletes take a web-based, online, computerized test. It checks their memory and reaction time and things like that, and we refer to that as a baseline data. And if they ever are injured, sustain a concussion, then they take that test again, and that compares the post-injury test with the baseline data, and that gives us a little bit more of an objective picture of brain function and where they're at in their recovery, and then as it relates to their return to play. Where before it was very subjective, we kind of relied a lot on, how are you feeling? Are you okay? Think you can go kind of deal. Now we're actually making it a little more objective with this computerized test. And it's the same test that NFL and National Hockey League and Major League Baseball, NASCAR. There's 4,000 to 5,000 high schools now that are using this program. University of Nebraska has used it for quite a few years, as has the Lincoln Public Schools. There's a couple schools here in town that have used this, what we refer to as neurocognitive testing, for 9 or 10 years. So we're kind of following their lead with it and have made it available. We're developing this as a statewide program, and so it's been very rewarding and very well accepted. And to date, we've tested 15,000 athletes in 2 years. And we've trained 250 physicians and healthcare providers on the use of neurocognitive testing. And then we've also trained about 450 high school test administrators so they can learn and conduct the baseline testing right there in the schools. Just being a part of that, in itself is quite rewarding, and to be, one, involved, and two, having an impact on the health and well-being of athletes across Nebraska. So yes, it is very rewarding.